Pregnancy. During pregnancy, can we do a dental treatment? Is it safe to get a dental treatment done? And what are the safe procedures which we can do? And what are some of the precautions that we should take forward during a pregnancy? So we will be looking into the details of these in this particular video. Hello all, this is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai, Raja, Annamalapuram since year 2001. If you have not subscribed to our channel, please do subscribe to our channel, Pearls Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. So when it comes to pregnancy, what's important is generally during pregnancy, we avoid all elective procedures. So what do we mean by elective procedures? Anything that can be deferred post-pregnancy becomes an elective procedure. So there is no pressing need for us to do the procedure during that time. If there is no pressing need, it can be deferred safely. We would prefer to defer it post-pregnancy to do the procedure. That is one. Two, what we need to understand is during pregnancy, there's a lot of hormonal changes that happens. Because of these hormonal changes, pregnancy gingivitis is a very, very common occurrence. What do we mean by pregnancy gingivitis? So any deposit that is happening on our tooth, usually the gum responds by an inflammatory response. The gums gets inflamed, there is bleeding gums. But during pregnancy, what happens? Because of the hormonal changes, there is an excessive response of the gum to those deposits. Because of those excessive response of those gums to those deposits, usually there is a lot of gum bleed and the gums get swollen. It can be a very painful condition for the patient also. So this is a common occurrence during pregnancy. It can be avoided if we go to keep our gums clean, our mouth healthy. So, and it's very safe to visit a dentist to get a gum cleanup done during this time. In fact, it is very beneficial for the patient and for the baby to keep a mouth healthy and clean during the course of pregnancy. So it's very safe to get it done. So that's a common occurrence. So when it comes to dental treatment which needs to be done, which procedure can be carried out, usually it's safe to carry out during the second trimester of pregnancy. So what are the procedures that can be done during the second trimester of pregnancy? Usually a simple fillings can be done. If the decay is very deep, somehow we have missed taking care of the decay, say the tooth requires a root canal. What can be done? Can we complete a root canal? Usually root canal will entitle us to take some x-rays during the process. And generally it's preferable that we avoid x-rays during pregnancy. So usually we don't complete the root canal, but we will be able to put a dressing inside the tooth which is going to make the tooth last till the pregnancy gets completed safely, and then we can actually take the tooth for root canal and then complete the process. So generally root canal, we give a dressing and then push the treatment towards a later date, but because for us to avoid taking an x-ray during the process. Can we extract a tooth? Again, if the tooth is very painful, extraction can be safely done during the second trimester of pregnancy. There is no harm in getting the tooth extraction done. But what we need to understand during extraction is, what are the medications are we going to prescribe for the patient? So are those medications safe for the mother as well as for the baby? Have we taken a proper consent from the attending doctor of the patient before we actually take the procedure? So if the doctor gives a go-ahead for an extraction procedure, we can usually take an extraction during the second trimester, but we should be careful about the medication what we prescribe to the patient. So these are some of the precautions that we should take care. Of course, so to sum up, we avoid generally elective procedures, we avoid taking x-rays, we avoid giving medications which is done usually on a routine basis. It's safe to do cleanup, it's safe to do fillings and some extractions as required, more so during second trimester of pregnancy. If there are any other questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.